Hi friends, hope you are doing well. So today I'll be discussing about a difference between the doctorate degree and the PhD degree. And this is an interesting question which came up recently because there was one of the viewers who actually has an MD degree and he would like to know if he can do a postdoc. So I did some research on this problem and I came up with several conclusions. So let's discuss some of these things in today's video. So essentially, to start with, we can say that the PhD is actually a subset of the doctorate. And so I'm going to discuss 3 points about what are the difference between the PhD and the doctorate degree, and then give you some examples to solidify this concept. And at the end of this video, I will answer the question about the medical degree and the doctorate. So the number one point is the difference between the PhD and doctorate is about the academic nature versus the practical nature. So in general, we consider the PhD to be an academic degree in the sense that it is given to you for detailed research done on a very narrow topic. So typically, if you see the title of any PhD thesis, you will find that these are very narrow topics in which the student has done a lot of work, published some papers, and then obtained the PhD degree. In contrast, what happens in the doctorate is that it can be academic, but it's generally professional. And here what happens that you tend to do applied research, you collect data on practical problems, and you may even demonstrate your expertise in situations, for example, in medicine, in management, in leadership, in nursing, or any of these fields. So this is a degree which is much more practical compared to the PhD. Now the second point is about the goals. Now again, PhD teaches you how to do research through the process of delving deep into the problem through literature survey, finding gaps in the literature, and then trying to fill this gap. Whereas the doctorate provides practical and professional experience in a field such as psychology, hospital management, nursing, medicine, or any of these fields. So a lot of practical component comes in here in terms of the doctorate degree, and very often the doctorate is given to professionals who actually want to work in a practical setting, not just be somebody who writes papers as a career for the rest of their life. So this is one of the main differences between PhD and doctorate. So I know an eminent scientist who always used to say that PhDs are people who are paid to publish papers. So doctorates may or may not be such people. Now the third issue is about the type of job you get. Now typically when you are a PhD, you can become a professor, you can become a research scientist, you can become a scientist, you can become an economist, a philosopher, a research engineer, and so on. So again, the PhD is very narrowly focused. For example, if you are in any particular department, if you are in the physics department, chemistry department, psychology, philosophy, computer science, mechanical engineering, you can essentially end up doing a PhD in this particular department. So it is very focused toward a particular department. Now, the doctorate is much more broad. Very often, doctorate is often given for medical professions like a physician or a dentist or a surgeon. And a very important fact is that in the US, the MD, which is given by medical school, is actually a professional doctorate. So with this definition, I would say that most postdoctoral positions would be open to such candidates, though you need to exactly verify whether this is so in any postdoctoral application. So there are many problems specifically in the health sciences, in the life sciences, which are very amenable to these kind of doctorates in the medicine field. So now let us look at some examples of the doctorate degree and type of people or the type of professions where this degree is being given. So essentially some of the doctorates which are popular are doctorate in behavioral health, doctorate in grief counseling, doctorate in physical therapy, doctorate in social work, doctorate of nursing practice, doctorate of technology management, doctorate of educational leadership and management, doctorate of international business, doctorate of theology, and so on. So essentially you can see that in many fields there is a lot of knowledge which is gained from practical application. So essentially you can figure out that if somebody is a practicing doctor, they will have a huge amount of experience by looking at the different patients who are coming into their practice or into their hospital. So this may be a dentist, it may be a physician, it may be somebody doing physical therapy, it may be a nurse. And so what happens is that if they can get a university or the medical college or the medical university to actually give them a doctorate, then they can get this particular degree. So this does answer the question about the PhD and the doctorate. Again, to point out the basic fact is that the PhD is a subset of the doctorate. PhD is much more narrow focused and doctorate is broad focused. But do keep in mind is that before you get into any doctorate program, about the possible jobs which you are likely to get at the end of this doctorate, because this is going to be very much dependent on the type of field you are in and the university you are getting this degree from. So many universities are nowadays giving online doctorate degree. You can check them out, but do make sure that at the end of this degree you are able to get a job, unless you just plan to embellish your name with a doctor in front of it. So I'll end this video here. I'll see you in a video sometime soon. See you then.